Hi everyone, welcome back, welcome back. I do hope you've been loving yourself over the weeks and months. We're going to continue love ourselves by learning about deep vein thrombosis or DVT. It's very important to know about DVT because it can happen to anyone and it can cause serious illness, disability, and in some cases even death. The good news is DVT is preventable and treatable if discovered early. So let's just dive right into it. So we're going to be looking at what is deep vein thrombosis or DVT, the complications of DVT, the risk factors of DVT, the symptoms of DVT, and we will also explore some tips that can help to prevent DVT. Let's do it. What is deep vein thrombosis? Venous thrombolism, VET, a term referring to blood clot in the vein, is an underdiagnosed and serious yet preventable medical condition that can cause disability and death. Deep vein thrombosis, DVT, is a medical condition that occurs when a blood clot is formed deep in the veins. These clots usually develop in the lower leg, the thigh, or pelvis, but they can also occur in the arms. Yes, what are the complications of DVT? The most serious complication of DVT happens when a part of the clot, the blood clot, breaks off, travels through the bloodstream to the lungs, causing a blockage called pulmonary embolism, PE. If the clot is small and with appropriate treatment, people can recover from PE, pulmonary embolism. However, there could be some damage to the lungs. If the clot is large, it can stop blood from reaching the lungs, and that may become fatal. Some of the people who suffer from DVT will have long-term complications caused by damage the clot does to the valves in the veins, called post-thrombotic syndrome, PTS. People with PTS have symptoms such as swelling, pain, discoloration, and in severe cases, scaling or ulcer in affected parts of the body. In some cases, symptoms can be so severe that a person becomes disabled. For people with DVT and PE, that's deep vein thrombosis and pulmonary embolism, can become chronic. It can become a chronic illness for about 30% of people who have had DVT or PE, and they are at risk of another episode. Okay, so now we're going to be looking at the risk factors. Almost anyone can have a DVT. However, certain factors can increase the chance of having this condition. The chances are increased even more for someone who has more than two of these factors at the same time. That's not good. Sitting for a long time, especially with cross-leg, paralysis, certain chronic medical illness such as heart or lung disease, cancer and its treatment can also increase the risk of blood clot. Hospitalization and surgery. More than 50% of the people who get DVT has been hospitalized or gone through surgery. 1/2 of blood clot occur during and soon after the hospitalization. Being immobile, not moving for long periods of time, for example, extended bed rest or extended travel. Older age, people who are getting older, that's a risk factor. Overweight, a family history of having DTE, recent or recurrent cancer. It can also occur during and just after pregnancy, or any injury or trauma. So these are the risk factors, and your chances are greater of getting DVT if you have 2 or more of these risk factors. So, what are the symptoms? It's very important that we know the signs, know the risk, and seek help. Everyone should know the signs and symptoms of DVT or PE. They should know their risk for DVT and PE and seek care immediately if they have any sign or symptoms of DVT or PE. About half of the people with DVT had no symptoms at all. But here are some of the common symptoms of DVT that occur in the affected parts of the body. So affected part meaning like that's where the clot is. So there might be swelling, pain, tenderness, redness of the area. If you have any of these symptoms, you should see your doctor as soon as possible. Signs and symptoms of PE, pulmonary embolism, could include difficulty breathing, faster than normal or irregular heartbeat, chest pain or discomfort, which usually worsens with a deep breath or coughing, anxiety, coughing up blood, very low blood pressure, lightheadedness or fainting. If you have any of these, seek medical help immediately. It's very, very important. Yes, preventing DVT. We can prevent it. So if you were ill, laid up in bed for a period of time due to surgery or illness or any injury, move around as soon as possible, as soon as you can. Start moving around. If you are at risk, remember we looked at the risk factor. Talk to your doctor about stuff like when you will be required to sit for long periods of time, such as when you're going to travel and you'll be sitting for more than 4 hours. While you're at work or whatever, when you're sitting down, even if you're watching TV, get up every 1 to 2 hours and move your body, walk around, stretch your muscle. And while you're sitting, you can do simple leg exercise. For example, raising and lowering your heels while your toes are on the floor, or raising and lowering your toes while your knees are on the floor. You can do those at any time while you're sitting. Wear loose-fitting clothes. You can also reduce your risk by maintaining a healthy body weight and avoiding a sedentary lifestyle. Follow your doctor's recommendation based on your individual risk factors. The foods that can prevent DVT are the same food that are recommended for a healthy lifestyle. The fish, the poultry, the fruits, the fresh fruits and vegetables, the beans, the nuts, the healthy fats, canola, olive oil. Also, get emotional support if you are not well mentally. Many people are struggling with anxiety and depression during these challenging times. Find ways to manage your stress. Do you, do what makes you comfortable to bring your stress down. Mindfulness, meditation, singing, dancing. Make small positive changes to your diet. Keep moving every day. Go for a walk. You can walk in your house, up and down the stairs, 10 to 15 minutes. Get that 150 minutes of exercise in weekly. Drink enough water. Listen to your body. Let's not wait until we have these chronic illness. Let's start listening to our bodies, feeding our bodies with the right food, giving our bodies the exercise it needs, drinking enough water, lowering that stress. Just smile, just lowering that stress. Positive affirmation. Keep safe and keep happy and healthy and love yourself until I see you again.